Good evening to all of you. I hope all of you are fine. We will be starting with a session on OET writing. I know the moment you heard this, you must have really got scared about it. But before we start, let's wait a couple of minutes for some of the others also to join in. So just wait. Um, I know it must be really tough on you, OET. Yes, four modules, need to clear it in a go. Yeah. So I'm guessing all of them are joining in. Yeah, I can see people joining in. Yes, great. Yeah. How is the weather out there? Well, here it's pretty good, actually, I should say. And it is pleasant, unlike the heat we had a couple of weeks back and all that. Yeah. Yeah, I can see. Yes, I hope all of them join in at the right time. Yeah, so I think it's time that we start the session. Before I start on OET writing, I would like to tell you a few things about our academy. It's known as the Envertiz Academy, and we have had almost 100% success in language proficiency test, and yeah, it's going on quite good. So this is Mr. Febin Syriac. He is the CEO and the founder of this academy and the consultancy as such. He's a nurse from Kasargod, Kerala, and he began his professional career in Mumbai. Then he went on to UK, where he was practicing as a nurse, and he did his higher education in nursing. Was working at Cambridge, and that's when it occurred to him that lots of nurses are facing this difficulty of doing these subjects and going abroad. So he thought he might as well help all of them, and that's when he started with Envertis Consultancy in 2014. And um, well, our we have our office at Aberdeen, Scotland, and we have a couple of offices in India and the UAE. Well, and coming to the office in India, it was opened in 2017. We have our branches in Bangalore, Chennai, Ludhiana, and of course, Kerala. So, our Kerala office, the corporate office, is at Tripunithura in Cochin. And we have excellent connectivity to this place. So, if you do want to join us, I'm sure you'll find it very easy because we have our metro connectivity and buses plying. So, it's an excellent spot, I should say. Uh, we have a lot of services that we do provide. We have candidate support, which includes eligibility screening, choosing your employer, and NMC registration. We also have visa facilities both for the family and the student, as well as ticketing facilities. Uh, this is our classrooms, and these are, I should say, really splendid because you have all these air conditioned classrooms and you have smart classes to where you can come and do your offline education. That is, you could do courses in either OET, IELTS, PT, or German. And we have excellent facilities for listening, which means we have a listening lab where we have good facilities that you could use for both OET, IELTS, and PT as well. Coming on to the facilities that, as I just mentioned, we have OET, IELTS, and PT. We also are India's first fully equipped OSCE training center. So, mind you, when you think about OSCE, remember us. We are the Envertis Academy. And don't forget our location. It is at Kochi, Kerala. Well, that brings us to the end of the introduction session of who we are and what we are. May I introduce myself? My name is Dr. Mary Benoy, and I'm a language trainer at Envertiz Academy. So, shall we start with the OET writing? I know the moment you heard OET writing, um, I don't know, you freaked out. I'm really sure about it. I know it's quite difficult, but it's not impossible. And I would like to tell you a few tips on OET writing. But before I go on to the tips, I would like to tell you about the criteria of OET writing. So, as you can see, we have six criteria for writing, which starts with purpose, on to content, followed by conciseness and clarity. The next is genre and style. Next is organization and layout. And the last is language. So, as you know, it's six of these criteria. The first one is purpose, which is 3 marks. The rest all are 7 marks. So, I think I'll just repeat it once more so that you get a clear idea about what are those. So, we start with purpose, next, content, conciseness and clarity, um, genre and style, organization and layout, and last, language. Okay, so today I will be speaking to you about the first two criteria, which is purpose and content. The moment we hear the word purpose, we would be only telling, okay, what is the purpose of the letter? That's what we ask. So when you say purpose and you say 3 marks, so you think it's not important, well, it's really important. The person who receives the letter, that is the recipient, must know why we are writing the letter, on for whom we are writing it, and what is the condition of the patient whom we are sending. So that covers part of the purpose, and the rest of the purpose is telling what all these are actually. So I would like to sum it up in the three P's. So the three P's are the purpose of the letter, that a patient's name, and the present condition. That's what the purpose is all about. Purpose includes what you're writing about, what is the patient's name, and what is the patient's condition presently. So, actually, the purpose has two conditions. The first condition is that the purpose should be immediately apparent, and the second condition is it should be sufficiently expanded. Now, what I mean by immediately apparent is that we need to include the three P's in this immediately apparent, which means the introduction should tell the reader or the recipient what is the reason that you're sending this patient for, what is the patient's name, and what is the present condition of the patient. So, once you cover all these three, you have your purpose half right. Then you must see that whatever has been written in your first paragraph is explained in the rest of the paragraphs. For example, say you're telling about a patient who has undergone colostomy, you must tell how he came in, what were his signs and symptoms. Then you need to tell how it was diagnosed, what were the investigations he underwent, and what is the treatment you have given him. Then, followed by what is the history of the patient, and lastly, what do you recommend the recipient to do about it. So, once you have written all this, I'm sure you will get the complete 3 marks. So, you see, it's not very difficult. It's a little bit tricky, I could say, but as you write more letters, you will definitely get a hold of how to do it. So, this is why I said, do come and join us at Envertiz. We are there both online and offline, and we have a lot of experienced tutors who are there to help you out. with all these modules. So do come and join us. Well, so that was about the purpose of the letter. Now, the next criterion that we do have is content. The moment I say content, we would have a lot of doubts on what is the content, what should the content contain. So, as usual, people come up with a lot of doubts. What should a letter contain? Should it contain all the information given in your case notes, or should we choose information? Well, I would say you need to choose based on your recipient and what you're writing for. So, your letter should contain only matter that you think should be told to a recipient. So, we'll just go through a few conditions. The first is the content has to be appropriate for your intended reader. What do you mean by intended reader? Well, the recipient to whom you're writing. This means that the information included in the letter should be for the specific recipient. Hence, according to the recipient, your matter should be worded. Say you have a pregnant patient and she comes to you not with a gynecological issue. Say she says about a toothache. Well, whom would you recommend her to go to? Yes, dentist, right. You'll be sending her to a dentist. And when you're going to send her to a dentist, you would want to send a letter with her that would tell about what her present condition is. So, as she comes to you, she says that she's got a toothache, and she also says that her fetal movements have reduced considerably over the last 12 hours. So, and her toothache has been there for almost 24 hours. So, she's in pain. So, I send her to a dentist. And when I send her to a dentist, do I tell the dentist that she is pregnant? Is that part of the content? Will that be part of the content? Yes, correct. I would tell the dentist that she is pregnant because he would be treating her and giving her medicines according to her present condition as well. Since she's pregnant, he would not be giving her certain medicines, for example, or he wouldn't be sending her for an x ray. So, these are the things that he has to know. He has to know about the thing that she's pregnant. So, that's one thing. Would I be telling about the toothache? Definitely. I am sending her for the toothache, so I would be telling about the toothache. So, this is what you sent the patient with a letter that contains the correct information in for the intended reader. The next condition for the content is your address, you should address what is needed to continue care, which means you will have to write all information regarding the treatment you provided that would help the recipient continue with his or her treatment. Say you have done a couple of investigations, or maybe you had given her a medicine, say a painkiller, or maybe you had started her on an antibiotic course. You will have to tell the dentist that this is what you had given her and this is what was done, so that the dentist has a clear idea about what was done so that he or she can continue with the treatment or maybe start with a new, say, a new form of treatment or some new antibiotics or new medicines. So, this, if this has to be done, you definitely have to give an idea of what you have done. So that is about the second condition. And lastly, the content of your letter should accurately represent the case notes. What do you mean by accurately represent? It means that whatever is given in your case notes might be, say, in short form, might not be in complete sentences, So you have to convert it into sentences, give the expanded forms of words that are in short form, and the letter should be apparently clear for what the recipient has to understand. For example, say it is given in the case note as X-ray, pneumonia ruled out. This would be interpreted as the patient's x ray showed that he or she does not have pneumonia. As against, I know many of you are thinking ruled out means confirmed. Well, no. Ruled out does not mean confirmed, it means the condition is just not there. So, once you get information similar to this, you need to explain it out in your letter. Similarly, say you have the word BIBA, BIBA written in your case notes. It just means brought in by ambulance. Well, actually, you need not write that. But I have seen many students get worried. Maybe it's a condition. Maybe you need to include it in your letter. But you don't have to include it, and you don't have to get petrified saying it. BIPA just means that the patient might have been in a serious condition or was brought in unconscious. So, BIBA just means brought in by ambulance. So, this is what I meant by giving the correct information. So, these are the two uh, criteria that we have: purpose and content. I think it's time for a short break. So, shall we go for a break, please? Hi, welcome back. So, I would like to just go through what all I had explained earlier. We started with the criteria of an OET letter. We said we had six criteria, which is purpose, content, conciseness and clarity, genre and style, organization and layout, and language. As I had mentioned, purpose is 3 marks, the rest are 7 marks each, and you need to fulfill your conditions to get the entire marks. So, as I said, purpose has two conditions: it should be immediately apparent and sufficiently expanded or explained, as I just mentioned what this is. So, you have to obviously write what is necessary for that particular reader or the recipient. The purpose of the letter should have the three P's, which was the purpose, the patient's name, and the present condition of the patient. So, when I said that, I had told about a patient who had just undergone colostomy. So, I would like to just tell you how you could write a sentence for that. You could write it as, I'm writing to refer Mr. Sam Peter, who is recovering after a colostomy. He requires further management. So, we have fulfilled all the three P's. The purpose is further management. The patient's name is, we said, Mr. Sam Peter, and the present condition is he is recovering after a colostomy. Well, I know you must be thinking whether it is after or from. Well, that's an entirely different topic that we have to discuss, which we will be doing in further webinars or live shows. We would be doing that because it is something that we need to discuss on. I know you must be having a lot of doubts. Well, we've got a couple of doubts that students did ask. Some of them were, just wanted to start with OET, so they had asked what are the modules that they have in OET. Well, We have four modules in OET: listening, reading, writing, and speaking. So even IELTS has these same modules. It's the same. We have these four modules, but it's all for a medical professional. So you must have understood it's all related to the medical profession, which means everything will have medical jargons and things like that. And I just remember we had a question on speaking. One of the students or the viewer wanted to know, during, prior to the role play, what were the things that we could ask an interlocutor. Well, it's quite specific. You can ask the name of the interlocutor during the 3 minutes preparation time. You can ask the meaning and the pronunciation of words that are given in your role play card. So these are things. These are the only things that you can ask an interlocutor during the preparation time. Well, one of the doubts that we had is, which is the most difficult module in OET? Well, there is nothing as most difficult. It depends upon how much you practice. This is exactly why we say, you need to practice. Practice makes you perfect. And do come to our academy. It's Envertiz Academy. We are located at Tripunithara, as I just mentioned. Do come to us. We are here and we are the professionals in this field. So we'll help you out with it. Another thing that, yes, the students had asked is, can we write all that we want in a letter? Well, that's what I explained initially. That's not possible. So I would be explaining this in the forthcoming sessions about what can be written and what cannot be written. I'm sure those of you who have already heard about OET or just gone through something of it know there are terms like relevant, semi-relevant, and irrelevant. Well, that's for another episode. So I will be explaining about that. So you can't write everything. You need to specify certain details, and only those details, because it depends upon the recipient and it depends upon the present condition of the patient, on what treatment the patient requires. Only those can be written in a letter. Another doubt students had asked is, um, can we skip one of the modules? Well, that's not possible. You'll have to give all your modules. And moreover, it depends on the country that you're going to. There are countries maybe where you can, if you have not got your required score in a particular module, you can rewrite just that module. Well, that's limited to certain countries. So do approaches at our consultancy. We are here to help you. The other doubts that did come up was about listening. Some of them said that when they had done their listening, they experienced certain noise in the background. Why was that? Well, that's part of how things become tough. Certain times you have background noise, and you'll have to be more intent. So I would definitely suggest you to do a lot of podcasts, get familiar with accents, so that your ear kind of picks up on what is required and leaves out the rest. So it's all about practice. It's about, the more you practice, the better you get. But I would definitely say smart work is better than hard work. So it's not just doing two modules per day, it's in doing a module and rectifying your mistakes, understanding from your mistakes, and see that you don't repeat these mistakes, especially when you're doing speaking. Because you can see, students know what to speak to their patients, but the scenario is very different in an OET speaking. You can't just be talking what you like. You'll probably have to limit what you need to say, make it very polite, see that you're speaking to a patient. And many a times you might get patients who are not cooperative with you. So it's the same. See, I've heard students ask, yes, that's the next doubt I had. What to do if the interlocutor seems unfriendly? Well, the interlocutor is there to just answer your questions. Don't consider his unfriendliness as something that's going to make you lose marks. No, just keep speaking, because that's how patients can be. You can have patients who are unfriendly, who are uncooperative, so you need to deal with those kind of patients. So see that, whoever you get, just elicit information from them, ask them in a polite manner, understand their feelings, empathize with them. That's what we see missing in most of the people. So yeah, that brings me to the next question. Is empathy important? Definitely empathy is important. You have to think in the having the mind of a patient. Think in terms of the patient, how the patient would feel, whether the patient is speaking arrogantly for a reason. Is the patient not happy? Obviously they come in with an illness, they expect you to help them out. So I would definitely say half the work is done if you're polite enough. So to do that, you definitely have to empathize with the patient, understand the patient. This comes in your voice, because your voice modulation. So these are all parts of speaking, and I'm sure we have a lot of episodes to cover all these modules and how it is done. A lot of doubts. So what I would want all of you to do is do comment on this session, and if you do have any doubts, queries, or suggestions that you have, please write to us. I mean, please give your comments on this session. You can comment on it. You can send us your suggestions, your queries, your what you want to ask us anything. Please do. Please feel free to do that, because we are here to help you. And don't forget our name. We are the Envertiz Academy, located at Kochi, and we are at Tripuntara. So I hope to join you for another session, and to come up with more doubt clearing sessions on grammar and on the rest of the modules. Hope to see you in another session. This is bye for now. Have a great day. Thank you.